Stony Brook Standard Patient Search. If for any reason you need to return to this slide at any time throughout the training, simply click the Home button in the bottom left-hand corner. You will also need to click the Next button in the bottom right-hand corner to advance to the next slide. Let's click Next to get started. The purpose of this e-learning is to provide best practice for all Stony Brook Medicine staff who complete patient search. This best practice specifically prescribes steps to be followed by Stony Brook Medicine stakeholders to ensure a successful patient search, supporting positive patient identification and patient safety. Click here to download the Stony Brook Standard Patient Search Guide, then return to this slide and click Next. Stony Brook Medicine supports standard methods for completing an effective patient search that ensures safety and medical record integrity standards. If using the primary step does not return the correct result, Stony Brook employees are advised to follow the best practice of proceeding to the next step until the patient is found before creating a new patient. Multiple searches are expected to be followed before entering a patient as a new patient in order to prevent the creation of a duplicate medical record (MRN). Going through each of the steps in order before adding a new patient to the system alleviates the concern that patients are linked to the correct medical record. At Stony Brook Medicine, patient safety is our primary goal. The final result of a creation of a duplicate medical record can greatly pose a risk to a patient's safety. To start the process, staff will ask the patient for their government identification, for example, driver's license, passport, etc. This is an important step in ensuring the correct patient is selected and their information in the system matches what is on their government-issued identification. Also, always remember to ask the patient if they have ever been seen at Stony Brook Medicine for either healthcare or medical services in order to avoid a serious or sentinel event. Key phrases. For your safety, we will be requesting to copy your picture ID and insurance card. We will return these to you as soon as we scan them into your record. Have you ever been seen at Stony Brook Medicine for healthcare or medical services? For lookup patient search, not creating a new MRN, when the patient's MRN, FIN, encounter, account, or Social Security number is known, best practice is to follow these steps in order. Step 1. Search by entering the patient's medical record number, or MRN. Be sure to enter the patient's medical record number correctly. Enter the MRN in the field as shown here. If patient is not found, continue to Step 2. Step 2. Search by entering patient's financial number, or FIN. This is also known as the account number or the encounter number. Remember to clear out all fields before beginning each search. The FIN encounter account number gets entered in the account number field. If patient is not found, continue to Step 3. Step 3. If searching by account number does not return the appropriate search results, you may then search for the patient by using a Social Security number, if one happens to be available. In order to ensure a proper search by Social Security number, all 9 numbers are required. Remember to clear out all fields before beginning each search. Enter the Social Security number in the Social Security number field and click Search. If patient is not found, continue to Step 4. Best practice is to begin using Step 4 if you do not have the patient's MRN, FIN, encounter, account, or Social Security number. Step 4. Search using variations of date of birth and patient's gender identity. Start by entering date of birth alone. If that does not produce a result, search by the date of birth with the patient's gender identity, and then date of birth with the opposite gender identity. If the patient is not found, continue to Step 5. Key phrasing. Hello, Mr. Alabaster. Please provide me with your date of birth, beginning with the month, day, and year. Thank you. Step 5. If searching by date of birth with and without patient's gender identity and opposite gender identity does not return the correct result for the patient's record or information, Then the next step is to search using variations of the patient's name without date of birth. First, search for the patient by their partial name. Enter the first 4 letters of the patient's last name and the first 2 letters of the patient's first name, as well as their mother's maiden name. If that does not produce a result, you may remove the mother's maiden name. Key phrases. As an additional identifier, we are asking for your mother's maiden name. This will help ensure we have your correct medical information in our electronic health record system. If that search does not produce the result you are looking for, you would then search by the first 2 letters of the patient's last name, the first letter of their first name, and their mother's maiden name. Again, if you still do not see the result you are looking for, you may remove the mother's maiden name. When searching by name, be sure to verify the patient was never known by a different last name or different first name. For example, the patient was recently married and changed their last name, recently got divorced and changed their last name back to their maiden name, recently hyphenated their last name. The patient may have multiple names, for example, Carmen Maria Garcia Vasquez Jones. In this case, best practice is to ensure you try different combinations to locate the patient. Or, the patient may have made a gender transition. In this instance, there is a likelihood of the patient having a different first name and a different gender. Key phrasing. Have you ever used or have you ever been known by another first or last name? Be sure to validate the patient's legal first name. They may have used a nickname in the past or possibly used their middle name instead of their legal first name. For example, the patient's first name is legally Robert, but when he was previously at the hospital, he stated Bob was his name. Make sure to ask for their legal full name. Key phrasing. Can you confirm your legal name? Also, be sure to confirm the spelling of the patient's name or request a form of legal identification, such as a driver's license or passport. There are countless names that have multiple spellings. For example, let's take the name Christina. This name could be spelled a multitude of different ways. Kristina, Krystina, Christina, etc. Depending on how the name is searched, the correct name may not appear, and this could result in a duplicate medical record being generated. If no record is located, best practice would be to continue to search for other possible spellings. Key phrasing. May I have the spelling of your first name? May I have the spelling of your last name? Searching for children. When searching for a child, you should verify that the child was or was not born at Stony Brook Medicine. The patient may have been identified under the mother's last name and first name at the time of birth. For example, patient was born at Stony Brook Medicine. When they arrived, the parent or guardian provided the patient's name. The user may not have realized the patient was previously entered in the system by another name when they were born. Make sure to verify the patient's place of birth to validate whether or not they were born at Stony Brook Medicine. Naming conventions have changed over the years with regard to newborn naming. It is imperative that a thorough search is always performed when searching for a child. Key phrasing. May I please have your place of birth? Duplicate MRNs. If in fact you do find a duplicate medical record number, please always remember to select the older historical medical record number, not the most recently created MRN. After identifying that a duplicate MRN in fact exists and that both medical records are the same patient, please immediately send an email to the following address: patientaccessqa@stonybrookmedicine.edu. Please always remember to include the following information in the email: correct spelling of the patient name, the duplicate MRN, and the date of birth. Any pertinent differences in the two MRNs should also be noted in the email if applicable. Please review the following example. This concludes the e-learning on the Stony Brook Standard Patient Search. Thank you from the Patient Access Department. See you at the next lesson.